Hi, my name is Edwin P. I'm a surgeon here at Hospital for Special Surgery, and we're going to be doing physical examination of the hip joint. And Cameron Kaiser here, one of our physician assistants, was kind enough to provide me with a subject for the examination. So the first part of the examination, I think, is a evaluation of the gait. So I'm going to have Cameron walk towards me and walk away so I can see him both coming towards me and away from me. What I'm looking at is really his overall alignment of his lower limbs, his hips, his knees. I'm looking at leg lengths, I'm looking at the pelvis, I'm looking at foot progression angle, assessing whether or not he has any abnormal pathology with the musculature. So, I'm seeing good stride length here, even balance, even leg lengths, and no real limp. So Cameron, maybe you could demonstrate an abductor lurch for me, which is a common pattern you may see with hip arthritis. Yeah, so with the abductor lurch, basically the patient will lean over the affected side, and this is an attempt to center their gravity over that joint and reduce joint reactive forces. So this is kind of a common pattern that a patient may have if they have an arthritic hip problem. What I would then do is palpate over the iliac crest and palpate over the trochanters and basically see if there's any soreness or tenderness in those areas. The spine evaluation and the hip evaluation also go hand in hand, so I might have Cameron do a forward bend to see flexibility in the spine, and you can come up and maybe lean backwards a little bit, just checking their mobility in the spine. So next part of the examination is I'll have the patient seated, and this will give me a good assessment of hip flexion strength. So basically I just have, for the right hip, I'd have you lift the thigh up, and I just give a little push here and see if that's causing any pain in the groin area or the iliopsoas region. Okay? Next I'm going to have you lie down on your back. Okay, so next I'll have the patient in a supine position, and we're going to check range of motion and do some quick tests to see if there's hip pathology. I usually start with the less affected joint, so if it's a right hip problem, I'm going to start on the left hip so as not to exacerbate any of your symptoms, and also give you a framework for comparison. So let's start with your left hip. Let me have a straight leg raise. So this is a quick way to kind of test joint reactive forces. It's called the Stinchfield test, and often that would bring on some pain in a patient with hip pathology. Then for range of motion, I'm going to have you roll up like a ball. So I bring knees to your chest. Let's go all the way up. What that does is it flattens the lumbar lordosis, and now I'm going to check extension. So Cameron's going to hold on to his right knee here and extend this left hip fully. You can see that this goes flat, so he does not have a flexion contracture. He reaches full extension. Let's go back to both knees flexed and bring this one down. This is checking the right hip for extension. Also has full extension on the right hip. Thank you. Now I'll go and check flexion. So it's this plane of motion for the left hip. This is hyperflexion. He gets to, I would say, about 125 degrees. It's very good, nice and flexible. With the knee at 90 degrees and the hip at 90 degrees, I'll check external rotation, and then I'll check internal rotation. This is often something that is lost in an arthritic hip, or in a patient with impingement. They may have limited internal rotation at 90 degrees of flexion. He's got about, I would say, 50 degrees of external rotation. This would be 0 of rotation. He's probably got about 10 to 15 degrees of internal rotation. You always have to make sure you're not manipulating the pelvis when you do these motions, and that the motion is truly coming from the hip joint. So I have my hand here on his pelvis, and I'm now checking abduction. So I'd say he's got about 45 degrees of abduction, and then he's got probably 15 degrees of adduction. So I'll just repeat it on the right side. We already did extension. So checking his right hip, this would be 90 degrees. He's got probably 120 to 130 degrees of flexion with the knee at 90, hip at 90. External rotation, also about 50 degrees. Internal rotation, he's got about 10 degrees. So these are fairly normal ranges of motion. I'm going to bring his leg way out there. That's about 45 degrees and 15 degrees of adduction, so nice and flexible. To check for labral pathology, I usually bring the hip up to hyperflexion, cross it over, and internally rotate. So that's called the Fader test, or flexion, adduction, and internal rotation. Often this would elicit a little bit of pain in the groin if a patient has a labral tear or has impingement. So that all seems to be pretty nice and Cameron there. Now we're going to have you turn onto your side. So why don't you turn and face that way? This is a good way to check now the trochanteric bursa and abductors. So have you totally on your side. I'll palpate the trochanter. So basically right over the vastus flare of the left hip at the trochanteric insertion of the abductor tendons. I'll palpate to see if there's any pain, and often that would be sore in somebody with greater trochanteric bursitis or trochanteric pain syndrome. I'm going to have you, let's pivot, let's do a clamshell. So you're going to bend your knee a little bit and pivot outward. So this is a good test for gluteus medius, and that's nice and strong. See if that elicits any pain. And I'll also have him do that with a straight leg, with the knee straight, and also see if there's any weakness or if I can elicit pain there. This is also a good test for IT band tightness. We can see if his IT band is tight, if it's painful down towards the insertion onto Gertie's tubercle. We can even bring it over his other leg and just get an idea with an Ober test if his IT band is tight. So it feels nice and flexible. Then I'll continue the examination by putting you prone. So let's do one more revolution that way. This is a good test to look at any sort of femoral version abnormalities. Basically, we're testing the hip in extension now and testing the rotational profile. So Cameron, I'll have you relax your knees and put them together, and just relax your hips. And then I look from this position, and I can see basically internal rotation if it's symmetric. And he's got about 15, 20 degrees of internal rotation in the prone position. Then we'll go external rotation as well in the prone position. He's got about 45 or 50 degrees. So that's all normal. We would just continue the revolution to check your other side. So that's basically a complete examination of the hip joint.